President Cyril Ramaphosa said that testing would be increased to help control the spread of infection of the coronavirus. There will also be testing for antibodies to determine just how much of the population has contracted COVID-19. Many people have not had symptoms, and not all COVID-19 deaths have been recorded as such. Discovery Health estimated 1 in 3 adults may have COVID-19. But for more on this, we are now joined by Doctor Kgosi Letlape, the President of the Health Professions Council of South Africa. Dr. Letlape, a very good evening to you. Thank you so much for joining us, and a warm welcome to the Globe.
Good evening, Simpiwe, and good evening to the viewers and listeners.
Now, Dr. Letlape, we've seen infection rates, dropping on a daily basis. Are we out of the woods yet?
This is the calm before the storm, as was said before, and as the Minister has amplified. Our trajectory will not be different from other people's trajectory. So we should expect a second wave later in the year or the beginning of next year. So we should not let our guard off. We should be vigilant. We should be grateful that the economy is opening up so that livelihoods can be restored. But we should not relent in terms of the non-pharmaceutical interventions.
Yeah, and just speaking of the second wave Eva just mentioned, it is assumed, Dr. Letlape, that most of those infected and recovered from this virus develop some sort of immunity. With that said, can a second wave be as devastating as the first?
The simple answer is we don't know. We must prepare for the worst and hope for the best. And none of us should be complacent. So we should not be relying on herd immunity when we have not tested the prevalence of antibodies across the nation. And we should have learned from all the steps that we have. What we should be concentrating on is that we be more prepared next time in terms of all the things that are essential. Affordable, quality PPE to be available at all healthcare points. Integration of public and private service provision. Ability to test when required. If we're going to be opening up the borders and having visitors coming in, and we have regulations of them being quarantined if they do not have a negative test, it might be helpful if the quarantine sites have the ability to test as well, so that people can then be tested. And if they are negative, it would then be the same as them having come in with a negative test, so they may not have to stay the 14 days out if they are asymptomatic. There should be maximum preparedness. We should assure the public that there will be no racketeering from all matters related to COVID-19, whether it is testing, is PPE. We have the national department has to play a more prominent role in terms of making tests more affordable, tests more accessible to all of us, including tests being accessible to those that visit our shores to prop up our economy.
Yeah, and so many countries have experienced a resurgence in COVID-19 infections after passing the peak. That is, what could possibly be attributed to this? And what could South Africa do to steer clear of this resurgence?
We must remember that this is a new virus and we should learn from each other. But if you even go back to the pandemic in 1920, there was a resurgence of the Spanish flu and there were more fatalities during the second wave. We should not be complacent. We should always have our guard up and we should be mindful. So at a personal level, our behavior should not change. We should voluntarily comply. We should voluntarily be living like we are in level 4 or level 5. And it should not be something that is a compulsion from the state. We should be doing it because that's how we protect each other as citizens.
You know, Dr. Letlape, South Africa has been highly commended for its robust testing protocols. Now that the figures, are dropping quite significantly and we've ostensibly passed the peak, where are we then in terms of testing? Do we still hold that record as, a country which is highly effective in testing?
I think when you have the testing capability that can meet the demand and you have spare capacity, then you are fit for purpose. But once you have a second wave, we should be more prepared. We should never get into a situation where we are talking about not enough tests. We should be ensuring that we have enough reagents and we have enough of everything that is needed for testing. But more importantly, we should be ensuring that we're making it easier for all citizens to be able to access testing.
Yeah.
I am hoping that the Ministry of Health will now be earnestly taking the lead so that the response to COVID-19 becomes a national response. We can integrate into all facilities that provide care.
Yeah.
I'm hoping that all the many general practitioners and other healthcare practitioners that have their own premises will be engaged and contracted to be able to provide services. We need to ensure that people can get the service at close to where they live, so that the issue of transport and people being in crowded public transport does not become a recurring and a major issue.
The reason I'm asking this question, Dr. Letlape, is that we've seen a great deal of complacency from the general citizenry, seeing that the figures have significantly dropped. Hence, people, stop taking the necessary precautions. I've seen so many people, without face masks. I've seen so many people not social distancing and, not sanitizing their hands. Do you get a sense that there is cooperation from the citizenry with regards to testing?
I think there are some citizens that are compliant, but as you rightfully say, there's a high rate of non-compliance. And I hope what will be done, as has been articulated by the Command Council, the Ministry, the President, is that those that run business premises, we've just opened up the business. And it is really businesses that need to ensure that those that come into their premises are compliant. Once we do that, the businesses would be ensuring that they minimize the risk of the lockdown levels having to be stepped up again and the risk of businesses having to be closed down. So we should ensure that people that come into our premises, whether we are in church, whether we are in schools, whether we are in shopping malls, whether we are in private business centers or restaurants, we ensure that there is compliance. It might be difficult when people are not complying in the street, but inside premises, the people that run those premises should ensure that people comply. And I think, I was concerned looking at visuals of one case where there's a person that had tried to kidnap a 4-year-old child, and you had two officials in court sitting next to each other, not wearing masks inside. Those are the things that we should not tolerate.
And speaking of social distancing in greater detail, Dr. Letlape, we've seen so many South Africans, turning their backs on social distancing, turning their backs on, wearing the face masks. And in terms of enforcing these regulations from the law enforcement agencies, what have you observed? Do you think there is still a greater deal of, enforcement?
I think we need to improve the ethics of the nation, and civil society need to step in. We, as members of civil society, should self-enforce these regulations. We don't want another Collins Khoza episode.
Yeah.
We need to get into a point where we are compliant. We as citizens can't be behaving in a manner that invites the country being a police state. Why do we want wearing of masks to be enforced by law enforcement officers? Why do you want that? Why can't we observe the rules about the 250 indoors, 500 outdoors, funerals being small? We just need to be more responsible. And I hope there will be greater engagement of community leaders in this respect, so that we self-police.
Yeah.
This might be the time where the police force brings all those community policing forums. So it becomes citizens on citizens for compliance, so that we do not blame it on the police, and the police can concentrate on dealing with serious crimes in the country.
You know, those questions you've just asked, Dr. Letlape, I suppose would be very much relevant, and it would be prudent that we apply those questions to the rationale that was used in allowing public events, to take place, in allowing an increase in the number of public gatherings. So is there any scientific data, perhaps, that actually alludes to the fact that we are now immune to contracting coronavirus as a result of the increase in the number of public gatherings?
No. I think the president alluded in his address, the Minister of Health articulated, the Minister of COCTA further explained that we're opening because we can't be in hiding and then die from starvation from an economy that doesn't exist.
Okay.
So it's a balancing act. It's not based on the fact that it is safe.
Okay.
It is based on the fact that it's pragmatic to do that. But we are not out of the woods. So all those things, it's application of science. But that is also applied to a limit. You may have heard religious leaders comment on the fact that any church or any religious group that has a facility that is big enough to accommodate 5,000, it should be 1.5 meters to the maximum of what they could accommodate. But the regulations are quite clear. If it is indoors, it doesn't matter how big it is.
Yes.
The maximum is 250. Because we've seen in this pandemic that in a closed area, the virus circulates much, much faster than in an open environment. And in an open environment, it's been restricted to 500. Remember that the more people you have, the less likely that there would be proper compliance with physical distancing.
Yeah.
So all those things are taken into consideration. I'm just applying my common sense to these issues. I don't sit on the Ministerial Advisory Committee. I'm not part of the command structure, but we should not give up on our common sense or common sensibilities as citizens. Let us work with government. Let us work together to protect ourselves. Remember, the infection is passed from citizen to citizen. It's not passed from the state to civil society or from the security apparatus to civil society. We've seen what happens in crowded areas. We've seen what happened in our prison system when an infection gets in. So let us change our paradigm to a paradigm where we care about each other and we take our civic duty to one another seriously, so that we voluntarily comply. So you must, on your own, if you see there's a crowd of 1,000 in Vilakazi Street, do your civic duty of not making it 1,001.
Yes.
That's what we need to do. That's how we're going to overcome the pandemic. This issue of playing a defying act and defying the state is acting in the interest of society and it's giving us advisories. But we need to take responsibility seriously as South Africans. Just as we have a constitution that vests rights with us, those rights are worthless if there are no responsibilities.
Right, right. Dr. Kgosi Letlape, the President of the Health Professions Council of South Africa, great point you've made there. Thank you so much for chatting to us this evening. We do appreciate your time.
Thank you for the invitation. And to South Africans, please wash your hands. Cough etiquette, physical distancing. Wear a mask when you are out of your household, when you are in public. And please, when you have people that are symptomatic and infected in the house, use masks inside the household.
Indeed. Thanks a lot for that, Dr. Letlape.